All right, a more detailed answer to itching and dialysis. So itching, also known as pruritus, is common with dialysis patients, and it can be caused by many different things. First thing is high phosphorus. When your phosphorus level builds up in your blood, it can lead to itching. Dialysis doesn't really remove all the phosphorus in your blood. Hemodialysis is good at it, but PD, not that good at it. So make sure you manage your phosphorus levels, take your medication to reduce your phosphorus. Itching is the beginning. After the itching comes the bumps. After the bumps comes a deadly disease called calciphylaxis. So please take your phosphorus medication. Dry skin also happens. Dry skin in dialysis patients are wet and wet, especially since your fluid intake is restricted. So this can lead to itching. So use a really good cream or ointment to help your dry skin. Talk to your doctor and nurse about it before you just try anything over the counter. Scented things are usually the things that you want to avoid. Another reason why you can have itchy skin is your toxin level. Maybe your uremic or your toxin levels are way too high. So dialysis is supposed to clean your blood and remove these toxins from your blood. But if your prescription is too weak and you need more dialysis, they need to adjust it so you don't have all these toxins that are building up, which can cause itching. So you can also have allergic reactions. Some people are allergic to the dialysis materials, and some people are allergic to the medications, including medications to treat your anemia. So let's talk about that. If you are on hemodialysis, if you start to itch right when the hemodialysis starts, maybe you're allergic to the residual chemicals or sterilants that are materials that's left over during the sterilization process by the manufacturers who make this stuff in the first place. Maybe when that goes in your system, it causes irritation and allergic reaction. And you'll see sometimes when the nurses or techs realize that you start to itch right when treatment starts, they'll flush the dialyzer, that artificial kidney. They'll continuously flush it and flush it and flush it and flush it with saline, meaning they pour saline through it and rinse it out. Now, they do this anyway for every hemodialysis patient. They use saline and they flush the tubes in the artificial kidney, the dialyzer. But if you always have some kind of allergic reaction and you itch, they'll probably use like a whole bag to flush that whole thing clean. Now, this is fine, but it can help reduce your symptoms. But in the most part, like your doctor should prescribe you a different dialyzer that you're not sensitive to. Now, unless it's the tubing that you're sensitive to, like the particulates that are left in the tubing, then that's one thing. But if it's actually the dialyzer, then it's to switch you to one for people who are very sensitive, who have allergic responses to this. Now, heparin is also something that's used in hemodialysis to help prevent clotting. But some people can develop a sensitivity to this or an allergy to it, which can cause itching and other symptoms. So sometimes for hemodialysis again, when that blood flow is changed, when you start the treatment, if you have circulation issues or blood pressure issues, sometimes starting dialysis can actually trigger like an itching sensation. So that may be something you may have to think about as well. That's pretty much it, I think. So your PCH, make sure your PCH isn't too high. Secondary hyperparathyroidism is what it's called, is when your parathyroid glands become overactive, causing an imbalance between calcium and phosphorus, which can lead to itching. So monitor your labs, see when the itching starts, and let me know if it helps out. Take care. Ciao.